So,
hi guys, my name is Katie.
I'm Jessica.
My name is Marcelin.
I'm Lauren.
And we're going to talk today about obstructive sleep apnea. And if you don't know what that is, Jessica's going to start us off.
Obstructive sleep apnea is a very common sleep disorder. It affects a wide variety of individuals. It's caused by a collapse of the soft tissue of the back of the throat, which causes a blockage in the airway. This leads to a decrease in oxygen saturation, which causes the brain to awaken. At that point, the breathing pattern returns to normal. This cycle can happen over and over again throughout the course of the night, sometimes hundreds of times. This leads to sleep fragmentation or fragmented sleep and sleepiness during the day. Some of the symptoms can include loud snoring, gasping or choking while they're sleeping, irritability, depression, and some of the effects of this condition are like fluctuating oxygen levels, the increase in the heart rate, an increased risk for stroke, impaired concentration, and so on.
And so the target audience and who does it really affect are typically men, ages 50 and over. They're generally overweight to obese. Smokers are a big population, but the smokers that actually actively smoke, people that consume alcohol, and patients that have recently had a stroke, especially if they're under the age of 50. And that also applies to the alcohol consumption.
So some treatments. There are some lifestyle changes that you can do. Basically, if you are overweight or obese, losing weight would be, your first option. You also, if you're smoking, to stop smoking, and alcohol consumption. If you try to prevent drinking alcohol like close to bedtime, that should help. If none of those work, you do have some options for treatment as far as like devices. Which are these on the screen. You've got the CPAP machine, which is the most common and most consistently effective. A lot of people don't like it because it can be loud and uncomfortable. Sometimes the masks can be cause claustrophobia. And then, of course, the machine can be loud. But there are some things you can do to change that. There are smaller masks or, ones that work for different people. Some of the newer models of the machines are quieter, so that can help with that. And then sometimes if the pressure is too much, you can use different models with adaptive pressure functions based on preference. And sometimes incorporating a humidifier can also help. The BiPAP machine is a little different. It delivers a preset pressure when breathing in and then a different pressure when breathing out. There's also, for mild cases, you can use different oil devices. So there's, some of them will pull like your jaw forward to open the airway while you sleep and like adjust the placement of your tongue. And, but those you'll have to see a dentist about for proper fitting and everything and follow-up care. If none of these work though, you may need surgery, depending on what your doctor recommends. And these are some pictures of the devices. So Lauren has the one of the CPAP devices. She has the mask. That's one of the smaller models that is less like not as large. You can see where that could potentially be uncomfortable though. Definitely takes some adjusting.
Sleeping position may help or worsen OSA. Here's why. Many people find sleeping on their back comfortable. Unfortunately, this is the worst sleeping position if you are at rest or suffering from OSA. People who are at risk of OSA, sleeping on either side is most recommended and maybe best for you. If you are comfortable sleeping on your stomach, this is a better option than sleeping on your back.